Knapp, student physical therapist. Have you ever had a knot in your neck? This is also known as a myofascial trigger point. A trigger point is defined as a hypersensitive spot within the top band of muscle. Trigger point is painful when using compression and can refer pain to other parts of the body. Two common treatments for trigger points are 1. Ischemic compression and 2. Dry needling. I wanted to compare the effects of these two treatments on trigger points, so I collected 4 randomized controlled trials and appraised their evidence. But before I tell you what I found, let me give you a quick demonstration of what ischemic compression is. So come on! This here's your average office worker, also known as my mom. She complains of frequent pains in her neck, but I don't think she's talking about me. I think she's talking about her trigger points. So right now, let's go and find some trigger points on my mom. So I'm going to palpate the upper trapezius muscle, which is a muscle that often has trigger points. So I'm looking for that bulge or hypersensitive spot, and once I think I found it, I'll perform the ischemic compression by just compressing that area. And it might start to feel uncomfortable or painful, but I'm just going to hold that area for a little bit. And when the pain or discomfort starts to dissipate, I'm going to ramp up my compression to try to elicit those symptoms again. I want to hold this position until I feel a give in the muscle, and this could take minutes or multiple treatment sessions. The goal of ischemic compression is to push out the old blood in the area and create a hyperemia response that brings in new blood with an increased oxygen supply and calcium reuptake. This allows the sarcomere, also known as the muscle cell, to lengthen and heal. And sometimes trigger points can cause headaches, and you can use ischemic compression or dry needling on trigger points to help relieve those headaches. For example, the sternocleidomastoid is a muscle that commonly has trigger points. So you can palpate that. I'll show you how to palpate that right here. All right, so Mom, if you could look to the right. So you can see the sternocleidomastoid muscle pop up right here. And I'm gonna feel for that bulge or hypersensitive spot. Once I think I found it, I'm going to compress, and that compression might refer pain to her head, which could be the thing that's causing her headaches. The sternocleidomastoid often causes headaches around the eye, on the forehead, in the ear, or in the back of the head. You can just hold that spot until hopefully it relieves the tension in the area and their headaches go away. Now, I'm going to demonstrate to you dry needling on my friend Little Mikey. Little Mikey is a garden variety voodoo doll that you can find around the house.
Hey guys, I'm Little Mikey.
I have to use Little Mikey instead of a real person because dry needling is still waiting to be approved in the state of California.
Whee!
The way dry needling works is that you find the trigger point, that bulge in the muscle.
Oh, yeah.
Right there. Okay, then you sanitize the area. And then you insert the needle into the trigger point. Okay, you can go in and out. This occasionally causes pain or discomfort. Oftentimes though, inserting the needle will cause a local twitch response. When a local twitch response happens, you will see the muscle physically twitch. This may last a couple of seconds and the individual may feel some discomfort. After this happens, you can take the needle out or leave it in for a couple minutes depending on your technique. Dry needling helps to release the trigger point and lengthen the sarcomere or muscle cell. Now let me tell you the bottom line for what I found from the 4 randomized trials I appraised. What I found was that the studies did not find one intervention superior to the other, and that both dry needling and ischemic compression have similar effects in treating myofascial trigger points. Ischemic compression may have more immediate pain relieving effects due to a quick reactive hyperemia response that occurs, where all the blood flows into the area. Multiple randomized trials found that dry needling can result in soreness hours after treatment, even 24 to 48 hours after, and this may mitigate immediate pain relieving effects. However, it is recommended to provide ischemic compression after dry needling in order to reduce the duration of soreness that could occur from dry needling. Both dry needling and ischemic compression have proved to be a significant alternative to medications and relieving tension headaches that come from myofascial trigger points, as we learned about doing on the sternocleidomastoid. The study conducted by Zugasi et al. Found that dry needling combined with ischemic compression reached minimal detectable change in improving cervical rotation active range of motion. These studies indicate that dry needling and ischemic compression are both found to provide beneficial effects in treating myofascial trigger points in the short term. Oh, hey there! For the physical therapist, it's important to remember that ischemic compression may provide more immediate pain-relieving effects than dry needling. Dry needling may cause more soreness after treatment due to the localized twitch response that often follows. It is recommended to combine ischemic compression with dry needling to reduce these symptoms. Because some states still do not allow dry needling, the physical therapist should understand the evidence suggests that ischemic compression produces similar effects, and ischemic compression alone is a good alternative to dry needling. Thank you for watching my video, and to read about all the information I found from appraising these articles, please see the attachment below. Have a blessed rest of your day. Bye!